PreviewDental.tv.
Welcome. I'm here with Dr. Mark Reisner of Professional Periodontics and Implant Dentistry. I'm so glad you could join me today.
Oh, thank you so much, Jackie. It's great to be here.
Well, let's begin by having you talk a little bit about your background and your training in dentistry.
Well, I did my specialty training at Boston University, and after finishing Boston University, my wife and I decided to fulfill a long-time dream and move to Colorado and enjoy the Colorado lifestyle. So when we moved here, I founded the practice about 28 years ago. It's hard to believe, but it's been 28 years ago. I feel very fortunate also that I practice with two wonderful people, Dr. Alan Pomerantz and Dr. Neil Nugaborn, and they're just great practitioners and wonderful people.
3 doctors, sounds great. What do you think sets your practice apart from others?
Well, I think that we take a very concerned and caring attitude, and that the patient comes first, and that we want to find out what the patient's needs are and attend to those to recommend appropriate treatment that's going to get them healthier and enable them to achieve the goals they want to.
Dr. Reisner, I understand that you're a specialist. So if I were a patient in need of periodontal treatment, what would happen in my first visit?
At your first visit, we'd like to meet you and get to know you, ask you about what your concerns are and why you are seeking our consultation. And then we would examine you and also evaluate and review your medical and dental histories, and then study the information we've gathered and make appropriate recommendations to address your concerns.
Some of those concerns could be periodontal disease. I know that's quite prevalent in folks that are 30 and over. If I didn't have any signs or symptoms, how would I know if I had this, and how would you go about determining whether I had that disease?
Well, unfortunately, periodontal disease is a silent disease, and it is the leading cause of tooth loss for people over 30 years of age. What it takes, though, to evaluate periodontal disease most often is a thorough evaluation. This is initially done by the referring doctor, and certainly done at our office as well.
And that's great. Now, if I have periodontal disease and I let it go, what's the worst case scenario? What could happen?
Well, the worst case scenario, unfortunately, is tooth loss, and that becomes very debilitating for people. The good news, though, is that there is treatment for periodontal disease, and timely treatment is really very important, because the longer this disease progresses, the more damage it does by destroying gum and bone attachment.
And are there other procedures outside of dental implants that are options for somebody who has tooth loss?
Oh,
or is that the most popular?
Yes, well, the most predictable treatment is dental implants. Other treatments are not as predictable and are more cumbersome for patients to wear. Removable dentures, which are really, most people don't like those. So really, dental implants have revolutionized dentistry, and we are very fortunate that we're able to offer this option to our patients to replace teeth that are missing, whether it's individual teeth or multiple teeth, or to anchor dentures that are very uncomfortable for patients.
There's nothing more important than your mouth and your teeth. Better take care of it best you can, huh?
Oh, yes. Yeah. Yes. I was able to place implants for my father to help anchor a lower denture that he had only been suffering with for years and years, and now he functions very well, doesn't have sore spots, has confidence, is able to chew a variety of foods, and it has enhanced his life very much, and I feel very fortunate I was able to provide this service for him.
Providing quality of life for a lot of people. If somebody is uncomfortable or having a bad situation in their mouth with their teeth, information on your website, I'm assuming.
Yes, please go to our website at yourdentalimplants.com.
Very good. Dr. Mark Reisner of Professional Periodontics and Implant Dentistry, thank you for joining me
Thank
today.
you. Pleasure, Jackie. Thank you.
Find more dentistry-related videos at PreviewDental.tv.